It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
Welcome back. As many of you rock and roll fans have heard, Mick Jagger had a recent heart surgery, and we're going to talk a little bit about valve replacement, which is what he had, with Dr. Patrick Ryan, MD of cardiothoracic surgery from Swedish Cardiac Surgery, Dr. Mick Jagger, MD and Chief of Cardiovascular Services, and an MD as well, and it's going to be interesting to talk about this. The heart, we got to have that going.
Yeah, you better have that going. It's amazing what is going on in cardiothoracic interventional medicine today, and that's what these two gentlemen are going to talk about.
All right, here is Shannon O'Kelly with our doctors.
Dr. Ryan, Dr. Zhang, welcome to Health Talk. How's everybody doing today?
Just great. Thank you very much.
Yeah, well, let's talk about your practice. Let's talk about cardiology at Swedish. Let's talk. Why don't you both kind of start chatting about that a little bit, and we'll kind of get into the topic here.
Sure. Patrick Ryan, I'm Chief of Cardiac Surgery at Swedish, and Dr. Zhang and I, along with the rest of the team, we actually work quite closely together with the cardiology department. So we try to provide as much team medicine as possible and really enjoy working together. As a matter of fact, we left the rest of the team behind this morning doing all the real work at the hospital.
Let's talk about the team. You talk about cardiology, and then we talk about cardiac surgery. So how you work as a team. A cardiologist is going to identify and diagnose pathologies. A cardiac surgeon then comes in and fixes those pathologies. That's how the team works. Is that fair to say?
Actually, that's fair to say for the past 20 years. But right now, there's a paradigm shift because cardiology and the CT surgery are working much closer right now. We have a 5-man strong force of CT surgery. We have about 30 cardiology in the workforce. And we work together on day by day. And today is a major structural conference. We have CT surgery as well as my partners working in the same group, discuss every single patient and go through the process.
Okay, so the paradigm shift you're talking about is you're working closely now. You're together, not individual. You're on the same team, same floor, working with the same patient.
That's correct. We actually work together discussing the patient to determine the right course of therapy, whether it be medical therapy or an interventional type of therapy. And in actuality, what Ming is talking about is the interventional therapies are starting to overlap quite a bit as well.
Let's talk about interventional therapies for our listeners. I mean, if you are talking in the field of cardiac surgery and cardiac interventional therapies, what are we talking about?
Well, traditionally, cardiac surgery involves an open procedure where you make larger incisions, and this type of operation has been around for 50 years. More recently, in the last decade or so, there's been a lot of big advances in catheter-based therapies that require actually input from both a surgical perspective and a traditional medical perspective to pull off.
And when you say cardiac interventional surgeries using, you're talking about going through the arteries. You're talking about using a catheter. I mean, this is sophisticated, detailed work. But let's talk about the catheter use and how it's used.
The catheter use, we identify the major artery and the major vein. We put a big catheter. We do the valve changes and a complex valve intervention as well as a structural intervention without opening the chest. And most of the time, surgeon and interventional cardiology work side by side in the same room doing the same procedure, working on the same patient.
Wow. Okay, this is amazing stuff, gentlemen. So I just want, again, our listeners to really appreciate what you're talking about. You're talking about going through an artery or vein, feeding that catheter up into the area of the heart, and changing out a valve. I think, I just want to throw this out. Didn't Mick Jagger from the Rolling Stones, I think he just had some kind of minimally invasive valve replacement. Am I right or wrong on that?
No, you're correct on that. He had his aortic valve replaced using a catheter-based technology, and we actually don't remove, when we do these procedures, which we've done about 900 or so in the past 7 or 8 years at Swedish, the old valve is not removed. It's simply pushed out of the way using a special device that has some metal scaffolding on the outside with a biologic tissue on the inside, making new valve.
Hold it. Can you talk about that? Can we get a little more detailed on that? Because I'm sure our listeners are driving down the road or listening right now going, what do you mean? You don't remove the valve, you push it out of the way. What does that mean? Maybe describe that a little bit.
It's almost like you install a new door into the old door without taking the old door out. All the degenerated valve has a calcification on top of it. And we use balloon expandable metal struts as well as some self-expanding metal struts, cannulate that device into that calcified structures and without moving the old structures.
We continue our conversations with Doctors Ryan and Zhang after this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Back with more from Dr. Patrick Ryan, Dr. Zhang, and Shannon O'Kelly.
Gentlemen, again, thank you for joining us here on Health Talk. I'm really impressed with your knowledge, and obviously Swedish has excellent cardiac intervention and cardiologists and cardiac surgeons. So thank you again for joining us. But how would I know if I have a valve problem and I need some kind of intervention?
The valve problem actually started with small symptoms, subtle symptoms: shortness of breath, chest pain, dizzy, lightheadedness, fatigue, out of proportion of usual daily activities. That's usually the initial sign. And then when the physical exam come up with primary care physician visit, you hear murmurs. And you see the lower extremity edemas. And you see some other sign of poor appetite, weight gain. That sort of symptom is actually the initial symptom for the valve problems.
So our listeners kind of understand, let's do a little cardiac anatomy. I mean, the heart is an amazing organ, but that valve has to open and close. I mean, how many times in a lifetime? Think about it. I mean, how many times in a day? And if it doesn't completely close, it causes leakage of blood through. Kind of describe that a little bit where the murmur comes from. That's what I'm kind of getting at here.
Yeah, so if we're talking about aortic stenosis, which is the Mick Jagger procedure, there are a series of 4 valves inside the heart, and they function as one-way doors. There's 2 on the right side on the way to the lungs. There's 2 on the left side on the way back from the lungs out to the body. The aortic valve lives between the main pumping chamber of the heart, called the left ventricle, that's the workhorse, and the main blood vessel of the body, called the aorta. It normally has 3 leaflets or flaps inside that are very, very tough and very flexible, sort of like your skin. When your heart beats and it pushes the blood through that opening, what's supposed to happen is those 3 flaps move out of the way. They go up against the inside of the main blood vessel, the aorta, and they create an opening of about maybe 2 to 3 square centimeters. Over time, people who have aortic stenosis develop calcium deposits within those leaflets, and they get stiff. It's kind of like old shoe leather. And gradually, by the time we see them for intervention, it's down to about 1 square centimeter, or 3/4 of an inch in diameter. Functionally, that acts like a governor. So when you try to walk upstairs or walk up a hill, you can't increase the blood flow to your large muscles of your body, and the pressure backs up. You get short of breath and fatigue.
That's where the symptoms come from. That's the fatigue, short of breath, tiredness. And what causes the valves to become stenotic? Is it the plaque formation? What's going on there?
The short answer is we don't exactly know. It does not seem to be the same process that affects the coronary arteries, causing blockages there, or blockages in, for instance, the carotid arteries or the leg arteries. Lately, that's focused on phospholipid metabolism and other complicated things, and they're starting to explore different ways of potentially treating aortic stenosis earlier with medicines. There's been some new research. Ming, do you have anything to add on that?
Actually, you're absolutely right. I think most of the process people still believe is a wear and tear. Because you're thinking about heartbeat 60 beats per minute for the rest of our life. Yeah, and the body is its own regenerative systems, but sometimes it's deficient.
As we wrap up again, gentlemen, thank you for the information. What is the recovery for most folks after one of these procedures?
From a catheter-based procedure, the recovery is generally overnight in the hospital, maybe 2 days, and then by a week you're back to normal.
So there's a great chance that I'm going to see Mick Jagger on stage again.
Absolutely.
All right, excellent. Thank you, gentlemen.
More information on cardiothoracic surgery from Swedish.org, and with our thanks to Dr. Ming Zhang and also Dr. Patrick Ryan, talking about the heart, Shannon, and as you mentioned, going in. Lots of advances.
Well, think about it, Tom. They're going up with a catheter through your femoral artery in your groin up to your heart to repair problems. That's amazing.
We'll be back with our next guest after this time out on Como.